Now, there's been a significant increase in malaria cases in the country recently, with Limpopo and Mpumalanga and KwaZulu-Natal being high-risk areas. The National Institute of Communicable Diseases is urging those who've been in those provinces in the past 6 weeks to get tested. According to the World Health Organization, nearly 620,000 people died globally due to malaria in 2021. Let's bring in Dr Chris van Straten, who's a global health advisor and clinical governance at International SOS. Thank you so much for your time, Dr Chris. We do appreciate it. Let's just bring it back home here in South Africa. What are our cases looking like, and should we be worried?
Hi, good evening, and thanks so much for inviting me on the show. The NICD has picked up an increase of malaria cases and some severe malaria cases in the last 6 weeks. And we don't need to be too alarmed, but we certainly need to be aware. We think there are a couple of reasons for this. The one is in the April season, the Easter period, a lot of people traveled up north to go visit family or friends or visit in countries where malaria is endemic. We see the spike every year about this time from people coming back from their trips where they might have picked up malaria. We also know that there's been an increased rainfall recently in certain parts of the country, especially up north. And if you have extra rain, that means you've got extra water lying around, stagnant water, and that's where the mosquitoes like to breed. So we are seeing an increased cases there. And then thirdly, we've also seen cases, mosquitoes hitching a lift in a taxi, making its way down to parts of Pretoria, Johannesburg, perhaps biting and infecting people. Probably not the majority of cases, but that's certainly what we've seen.
When you say we've seen this increase, and it's normally expected this time of the year, are you able to give us figures as to, compared to last year, what the figures look like if we are seeing this increase?
Yeah, so this year there's been a bit of a bigger increase. And again, we think that's related to the number of people who have been traveling. Remember that this time previously, in the last 2 years, we were all battling COVID. And people couldn't travel because of lockdown and restrictions. So what we think is particularly happening at the moment is that more people have been able to travel and want to travel, and have also traveled to countries where we said earlier malaria is endemic, like Angola or Mozambique, and are now coming back from these countries and have perhaps picked up malaria. So I think that has certainly played a role. More people traveling, more people exposed, and more people coming back. But here's an important thing. Yeah. Malaria can mimic other conditions. So if you have a fever, joint aches and pains, that can be flu-like symptoms. So just a big word of warning, please, to those who've been traveling recently, either up north in South Africa or in other malaria countries, and you got a fever, please get tested so we don't miss it.
Okay, maybe just tell us what else we should be looking out for in terms of symptoms, especially if you've been in areas of concern, like you've mentioned here in Gauteng. There is a bit of a spike in malaria cases. If one is feeling a little bit strange, what are the symptoms we should be looking out for?
Exactly. So it's the great mimicker. So historically, malaria has been famous for mimicking other conditions. So if you have symptoms of flu, joint aches, especially that fever, and you've been traveling recently, and even if you get tested for COVID and the COVID is positive or the flu is positive, please make sure that doctors also exclude malaria. We've seen numerous cases in the last 18 months where an individual has had COVID and malaria, but because the COVID was positive, the doctors didn't always think to ask, hang on, have you been traveling, and could malaria be part of this picture? So those generic symptoms and signs, and always make sure they test if you've been traveling in a malaria area.
I want to ask you, Doctor, in terms of those who have been testing positive for malaria, do we know if they have been vaccinated for malaria? How does that whole process work, and do you encourage those that have not had any sort of malaria vaccine to go out and do so?
Great question, excellent question. So there's been a lot of focus recently on the RSS and R21 vaccines. They have been authorized by the WHO and the MOH in specific countries. So it's only countries like Kenya, it's Malawi, where it's being basically rolled out for children under the age of 5. And the reason for that is actually the most people that get infected and die from malaria every year are children under the age of 5 in Africa. So it's not widely available. I can't access and get that vaccine yet. But I tell you what, if it's available in a couple of years' time, I will certainly be getting a shot myself. So it's not readily available at the moment, but we'll certainly keep an eye on it. In the interim, there's many things you can do to protect yourself, and that's know where the malaria areas are, mosquito nets impregnated with insect repellents, the malaria prophylaxis tablets, which I always take when I'm traveling in malaria risk areas, and preventing mosquito bites.
Could you maybe just tell us which provinces are of concern at this moment? I know we said KwaZulu-Natal as well as Gauteng, but where else should we be a little bit more extra cautious because of these malaria cases?
Absolutely, good question. It really is focused on the northern parts of the country and where South Africa borders with other countries where malaria is endemic. So, for example, the borders up on Limpopo. Limpopo is a province, but also the borders with Botswana. Gauteng generally doesn't see much malaria except where we've had a warm, wet, let's say early winter, which we're having in many parts. And also with Mozambique. Mozambique has very high levels of endemic malaria transmission. So it's those provinces, KwaZulu-Natal, and again, it's the northern parts or where they border with other countries where malaria is certainly endemic. So we want to be careful there. And the Kruger Park, for example, many people like to visit this time of year because there's more visibility. And historically in winter months, we didn't take prophylaxis when going to the Kruger. But I think certainly up north, in this warmer winter, wetter winter, there could be a risk and certainly worth considering and discussing prophylaxis and preventing the mosquito bites. Great question.
And just lastly, Doctor, would you say that the situation is under control? You know, somebody watching and going, I mean, I had somebody on yesterday speaking about an outbreak with mumps, and we were told there's no need to worry at this point. Would you say the same for malaria cases currently in South Africa? You know, is the situation under control?
Really great question. The answer is, I think it's probably under control. But we do need to be aware. So I'm really appreciative to eNCA, the news channels, the NICD, all the channels that have been making people aware. And by the way, here's the good thing about malaria. If you pick it up early and it's not complicated, it hasn't become severe, it's very treatable. And we've treated thousands of cases successfully over the last 10 years. So one, keep up the awareness. And the NICD has done a great job of tracking, picking up the spike, and they'll continue to track. And probably those numbers will settle down the next weeks and months. But keep aware, and if you've been traveling, ask to test for malaria. Great question.
Certainly. Thank you so much for your time this evening and bringing us to the attention of the increase of malaria cases. That is Dr. Chris van Straten from the International SOS. And as you heard him say, if you're not feeling too well, ask to be tested for malaria, especially if you have been traveling.